Well, hello everybody. My name is Dr. Oscar Kutsia from Designs for Health, and I'm the Senior Director of Education here. And I'm very excited today to be joined by Dr. Andy Franklyn Miller. He's the Chief Medical and Innovation Officer at Nuritas. And today we'll be discussing PeptiSleep, which is a trademark product ingredient featured in one of our products from Designs for Health called BioSleep Peptides.
So we often think, oh God, I only got 4 hours sleep or 5 hours sleep. That might be fine because sleep quality matters. So the phases of sleep and the time of you spend in each of those phases. And we know nearly half the population have some form of wearable device which tracks sleep. So measures those qualities. So when we looked at this area, we wanted to look at what was out in the market already and how we might differentiate and improve the quality as well as the duration of sleep. And so when we were designing the interactions and we were looking for the peptides that would deliver that sort of response, we wanted them short acting enough to be able to help us get to sleep and improve the quality, but we didn't want that grogginess in the morning.
So it's interesting and it sounds very innovative, right? What you've created here. So can you kind of tell the listeners a little bit about PeptiSleep as it compares to maybe what everybody is looking for sleep, which is melatonin-based nutraceuticals,
Sure.
right?
Yeah.
So just kind of elaborate a little bit on that.
Pharma tend to use something called the lead sleep evaluation questionnaire. It's divided up into four, and those four categories are getting to sleep, the quality of your sleep, how you feel when you awake following sleep, and the next day behavior. And hence you can kind of see how it would interpret that with an intervention, whether you've gone to sleep earlier. So what we did was look at that score with PeptiSleep in a decent study over 8 weeks. And we looked at each of those four phases, and we found that PeptiSleep improved all four domains. So there was a 3% increase in getting to sleep, 12% increase in the quality of the sleep, 7% increase in ease of awakening, and 7% the day after. And that compares very well to pharmaceutical products and to melatonin, who are often very good at getting you to sleep. It's a sedative.
Right.
In effect. And the difficulty with those is they often have a hangover effect in the morning. So people often talk about that melatonin effect or a prescription effect of the hangover. And we've not seen that in PeptiSleep. We delivered a gradual increase in dose to make sure this was safe. And so we went up to 4 times the dose, which is 250 milligram dose, and saw no significant increase in any side effects. So we know it's a safe product. And the excitement really is it's a different approach. So it's not something you need to combine with 2 other ingredients. It formulates well in multiple end applications, tolerated well by the patient, and really we're very excited about it. It launched this year, and we've already seen some significant adoption.